Hello, welcome to this video. My name is Christiana Mausisera. I'm a public health practitioner. In this video, I would like to talk about vaginal dryness. Yes, so vaginal dryness is a painful symptom that every woman or most women will experience at some point in their life, and it commonly happens around menopause. That is from 45 years going, where there is a natural reduction in the production of estrogen. So it causes the vaginal walls to become thin, dry, and it could even be, inflamed, and that can be very painful. Now, estrogen is a primary female hormone, and when it comes to the vagina, it maintains the thickness of the vaginal wall. It ensures the vaginal wall is moisturized. So the inside of the vagina is moisturized, well moisturized. Now, as you grow older, as I mentioned earlier, the walls become thin and dry. So that is why during menopause there's dryness in the vagina. Now, apart from menopause, there are other times that your estrogen level will be low, and for that matter, you can experience dryness of the vagina. First one is after childbirth. In fact, after childbirth, a lot of things happen to the vagina. However, most people do not talk about it, especially dryness of the vagina. So that could happen because your body produces less estrogen after delivery. Then during breastfeeding, estrogen level production is low. So you can also experience dryness of the vagina. If you are taking contraceptive pill, a major side effect is dryness of the vagina. In fact, even though the pill contains estrogen, what happens is that the synthetic estrogen suppresses your body's ability to produce more estrogen naturally. So in other words, that it creates that negative feedback mechanism to your brain. So it's telling your brain there is already estrogen in the system, so you don't need to produce more. That kind of thing, literally. So low estrogen level will cause you to have experience dryness of the vagina. Now, apart from that, if you've been put on certain prescribed medications such as anti-estrogen medications to treat your fibroid, to manage your fibroid, or maybe if you have endometriosis, that could also cause as a side effect, you could have dryness of the vagina. And if we say dryness of the vagina, it is not only referring to just the inside, but even the vulva. Yes, it can be so dry to the extent that there is irritation and the woman feels pain even whilst wearing her pants or her underwear. And even sometimes if the woman wants to stand, she feels pain. If she's sitting, she feels pain. She can't walk because there is pain at the vulva. So it can be very, very uncomfortable. So now, what are other factors that are not related to estrogen but can cause a woman to experience dryness of vagina? The first one is diabetes. If you have diabetes, you have high blood sugar level, especially if the diabetes is poorly managed. You are not taking the medication, not following the diet, you still eat as you used to be, you are just there. Or if you have high blood sugar level, what will happen is that it could destroy the blood vessels that supply the vaginal wall. Now, it's important to know that the moisturization or lubrication of the vagina is as a result of what? Increased blood flow to the vaginal wall. So if there is reduction in the blood flow to the vagina because some blood vessels have been destroyed, it means the vagina cannot be moisturized or cannot be well moisturized. So it will be dry and it will cause inflammation and pain. Then another factor is antihistamines. If you are taking antihistamines or medications for cold and allergy, that can, as a side effect, could also cause dryness of the vagina. Then if a woman is douching, in fact these days there are several things that women are inserting in their vagina. Why? You don't have any business there in cleaning the inside of the vagina. The vagina has its own mechanism for cleaning itself. So please stop inserting all these harsh chemicals. you don't need to use this harsh, scented soaps on to clean the vulva or the vagina. The vagina is the inside. The vulva is all the structures you see when you use a mirror to look in between your thighs. So please, let's stop the douching. It doesn't help. So if you are always inserting, feminine hygiene chemicals or whatever product to clean your vagina, eventually what will happen is that you will destroy the cells that line the vaginal wall that produce this lubricants. You destroy the glands, you destroy the lining of the vagina, and it's not healthy. So please, it can even lead to inflammation of the walls of the vagina, and if that happens, it could result in infection, because you've caused irritation of the vaginal walls. So what will happen is that there is already a tear in the skin of the vaginal wall. So any bacteria, any harmful bacteria that is there can just penetrate and cause harm. So please, douching is a no. Do not douche. It's a bad practice. If you have vaginal odor, that is why you want to douche, seek medical care instead. And if there is any infection, the doctor would identify, diagnose you, and treat it. Then you are free. You don't need to be douching. It's very important. So other factors, I've mentioned diabetes, I've mentioned the antihistamines, and then antidepressants. Some antidepressants also have that side effects, as vaginal dryness as side effects. Then I mentioned smoking as well. Yeah, so basically those are, and then douching. Yeah, so those are the 4 other factors that could cause vaginal dryness. So please, vaginal dryness is painful, it's uncomfortable, but don't be embarrassed. Seek medical care. And you can also use, if you experience vaginal dryness during sex, the first thing you can do is to get water-based lubricants. A common example is the KY gel. So you apply some into your vagina, and then you apply some to your partner's penis before penetration. However, if you do this and you still have that discomfort or pain, in fact, you can even bleed. If you have vaginal dryness, you can bleed after sex or during sex. You can feel sore around your vulva. It can be very uncomfortable. If you do this and still, please seek medical care. The doctor will, do further assessment and manage it so that you'll be comfortable. So thank you, and please watch out for more videos. Bye.